So, as I said earlier, part of the project is to get an understanding of what you know, what you don't know, what you want to know, and what you think we should do about this. So, we've conducted 6 employer interviews and a survey. We wanted to get some qualitative information from employers, both small and large, public and private, local and national, to get a sense of just what is the level of knowledge out there, what are some of the feelings of those that we that have had conversations. And so what we found, as you might expect, is varying levels of understanding. When we asked her how much does she know or what does she know, not a whole lot. Another said a lot. So we had varying responses to that question. All of the employers have had conversations with their health plans at some level about the changes in payment reform, but it's usually at a very high kind of strategic level. All of the payers have given the impression and have said that they are on board and they're very committed to payment reform. But the employers said, on the other hand, what are the results so far? They haven't seen what difference it's made. Are the decreases in costs that we've seen over the last couple of years as a result of payment reform or the economy or some other factor? So there's some uncertainty about what the results have been, even though we've been in this and have been pursuing payment reform here for quite a few years by now. They're very unsure of the year-end settlements, the provider cash flow, the pace of change. How are the targets set? All of these total cost of care contracts have targets, and how are those negotiated? And that's where I think what Michael was talking about, the consolidation and the leverage of large groups, may come to play. How are they performing against those targets? What are the concerns? What are some ways of addressing some of the concerns of the provider consolidation? 2 of the employers have actually had conversations with their health plans and have included their key provider groups in those conversations and found them to be very enlightening. Those same 2, I believe, no, it was 2 others have also included information in their RFPs, questions in their RFPs of their plans about payment reform, and have asked them questions that actually they got out of another organization, the Catalyst for Payment Reform, CPR, which is a national organization that is working in the same direction that we are here locally. They've had conversations with employers and plans together to understand those contracts. They have expressed in those discussions the desire to accelerate reform, to make it happen faster. And in one case, they provided input into what the actual terms of the contract looked like and felt that it had made a significant difference. And so there is value in actually having those kinds of meetings and conversations. And all of them agreed that collective action is much more powerful than any one individual employer can have in influencing what the health plans do and how they do it. One of the employers who did have a meeting with the plan and the provider together said we needed to go to school before we went to that meeting, though, because in order to be intelligent enough to ask the questions and understand what's going on in these discussions between them, there is a learning curve for employers to go up. We also did surveys, and for those employee benefits types here, we're asking you to contribute to this. So these are preliminary findings. And we asked employers to rank on a scale of 1 being low and 6 being high, how well informed did they feel they were, just a very subjective question. So it's less than, it's not 5 or 6 or 4 even. And then how important is it for them to know what their health plans are negotiating in these PMPM targets for their employers and for their health plans? And that was high, 4.6. How important is it to be able to compare the providers' targets one to another to get some more transparency around that? That was a bit higher, 4.8. And then how important was it to compare that actual provider's performance against those targets? And that was very high, 5.1. And that might be, in effect, as I've been thinking about consolidation and what happens with that, a way of starting to blunt some of the the power that consolidation has if there's more transparency about performance against these targets and what these targets actually look like compared to each other. Set PMPM targets to decrease the rate of increase or reduce costs over time was the answer to the question we asked. Okay, so these targets get set. We don't know how they get set necessarily, but we hear that it is set to decrease the rate of increase. So there's an assumption that there's going to be trend. There'll be increasing costs over time, but that we're going to take that down just a notch from what it would be otherwise. And so we asked employers what they felt that number should be. And most of them felt that it should either decrease the rate of increase or reduce costs over time. The alternatives were to totally reduce the cost, or to keep it flat, or to not have any impact on it at all. And then on a scale of 1 to 6, how important is it to include downside risk in provider contracts? I think we all know that that's a very powerful incentive and that it's probably time to start putting that into those contracts. We also asked what roles employers could play, and we gave them a variety of roles and then asked for write-in answers. But the most popular roles were to meet with care systems and health plans together, I think, to get a better understanding of what those contracts look like and what the terms are, and also to have input into the amount of revenue that's at risk for quality. So those were the most popular. The second most popular were to provide input on the targets and trends, and then to provide input on the amount of at risk for savings. So those are what our employers have said here so far. Any comments or questions on that from anyone? And then I wanted to include a bit of information about what others are saying that you should be doing. United Healthcare came out with a recent paper called Farewell to Fee-for-Service, where they talked about a variety of stakeholders and what their roles should be. And in this, they said that employers should be catalysts for testing new payment models. They should be exploring different value-based benefit designs and deploying employee incentives for wise choices. So putting incentives on the employee side to choose the providers that are of higher value, which of course you will only know if you have some transparency about their performance, right? The Institute of Medicine had a report that came out a couple of months before that called Best Care at Lower Costs. This made a big splash in the media, and it was mostly highlighted about the amount of waste in healthcare. But they also had some action steps in there for every stakeholder, and employers need to promote transparency and quality and value and outcomes to aid consumers in their care decisions. So there's kind of a theme here, is that we need to know what the quality and the costs look like and compare them to each other, and then drive our employees, consumers, to those providers. Elliot Fisher is the father of the Dartmouth Atlas that I referred to earlier, and he's written an article called Slowing the Growth of Healthcare Spending, If Not Us, Then Who? And he has said that employers need to help slow the medical arms race. So that is the higher technology, higher cost services, the latest and greatest, the newest thing. Let's try to figure out ways to start to slow that, accelerate payment reform transition, so push on the accelerator and move market share to higher value providers. So again, a common theme. Other roles that we kind of identified in talking and thinking with others is that maybe there needs to be a way of measuring waste and what the health plans are doing in reducing that waste. We don't have, as one employer said, a waste report card for our health plans to ask them what they're doing about that. And then to change payment models to reward value and to change them faster, to require the health plans in some way, shape, or form to reform payment and keep them accountable to a timeline and a number of some sort, or in some cases, perhaps, to contract directly with providers, again, which is something that has been done in this market before. So that's what others are saying.